Sounding good? Cool. All right, so I'm Dr. Claire Vaiden, veterinarian with BAP. I've worked with several of you on various cases and with some of our regional trainings and all that, but it's great to see some new faces and excited to work together in the future. So I'm going to start kind of going off of what Taylor ended with when it comes to building cases and start with chatting a little bit about some tools and some scales that are available to us that we can use in the field as we are working on building our cases, trying to figure out if we have a case. So when I'm talking about these tools and these scales, a few things to kind of think about are that these shouldn't be used as sole evidence in a case. They shouldn't be used as the sole reason why we're going to move forward with charges, but they can be a really handy tool, especially when we're seeing situations like, seems like we all were a little conflicted about, say, the 5 horses that were kept in that tiny enclosure. Scales like this can be ways that we can take subjective findings in the field and turn them into some more objective measurements, generally on a numbered scale. So the first one I want to talk about is the Tufts Animal Care and Condition Scale. Has anyone used this or is familiar with this one? Cool, a few people, yeah. So obviously came out of Tufts Veterinary College some years ago. I think it was developed in the 90s, and it's specifically for dogs. So I will occasionally extrapolate it to, cats or other companion animals. It's difficult to extrapolate to livestock, though. So like Rebecca mentioned earlier today, we are working on developing some scales that we can use for our more primarily outdoor animals, such as livestock. So Tufts Animal Care and Condition Scale, or TACC, has a few different components. There's the weather safety scale that you see here. Have you guys been getting a lot of calls about outdoor dogs recently? We've been getting a ton of calls about outdoor dogs. And so I've used the scale a few times to assess the situation, assess the dog, and determine if this is something that could be a neglectful situation. So the TACC scales generally operate on a 1 to 5, 1 being an acceptable situation and 5 being the kind of worst case scenario. So you can see here we've got our colder temperatures down on the x-axis, warmer temperatures on the y-axis, and you kind of find the temperature, follow to that line, and follow up, and then based on the size of the dog, it'll give you a determination for where that number falls. And then, of course, there's going to be some other things to consider. So, of course, it matters if that dog has adequate shelter, adequate bedding. If it's a northern breed or a long-haired dog, that might make a difference too. So just some things to consider and a good resource. We do have this printed out in our handouts by the snack table, so feel free to grab a few. A few other parts of the TACC scale that I like, it also provides an environmental health scale. So again, we're operating on a scale of 1 to 5, 1 being an acceptable condition. We've got a clean and dry environment. There's no accumulated waste material, no odor, the dog's got plenty of food and water, all the way up to a 5, where we may have a lot of accumulation of feces or urine. There might be an overwhelming odor. I'm sure we've all been in these large-scale hoarding houses where, we can really smell that ammonia, it makes our eyes water, those kind of things. And, and there may be some debris in the area that make it difficult for the animal to ambulate, express normal behavior, may pose a danger to the animal. So one thing I want to mention when we're using these scales is it can be a really good resource for us as investigators out in the field to assess a situation and say, oh, on the TACC scale, this is a 5. But when we're writing and preparing our reports, I think it's still really important to include some of this language and really describe what we're seeing. Because a judge and a jury, they're not going to understand this scale, and it's going to be hard for them to contextualize what a 5 is on the TACC scale. But if you describe that your eyes immediately started watering when you entered a building, there was no path to get from the living room to the bedroom. There were dogs, trapped in certain areas, and they had to jump over trash or debris to exit the room. That's going to paint a much more vivid picture and assist your DAs in moving forward with charges and help when you get to a trial as well. And so the last part of the TACC scale I'm going to talk about today is the physical care scale. And so again, same kind of thing, we're operating on a 1 to 5, but we're looking at the health and condition of the animal as opposed to the environment. So, we're looking at the length of their hair, those overgrown nails, we're looking at fecal urine, matting, staining, things like that, and as well as collars, chains. If those are present, they may be embedded, and that's certainly something to consider. TACC also includes a body condition scoring scale. They use a 1 out of 5. I'm going to talk a little bit about the Purina scales in a few slides, which uses a 1 out of 9. I find that tends to be the more kind of universally used scale, and I think having more numbers is a little more descriptive and provides, just a little bit clearer picture. So when we're using the TACC scale, another thing I really like about it is it includes this section on interpretation. So it tells you, based on where we find those numbers, what action may be needed. So again, it just helps kind of conceptualize what we're seeing in the field, what's making us feel kind of icky about a situation. We can assign it a number and then come here and say, well, that environmental health scored a 3. And so 3 here, indicators of neglect might be present, timely assessment or correction of problems may be required. So it's not telling you what to do, but it can kind of provide a little bit of guidance. So in those kind of circumstances, that might be a situation where maybe a warning, some education, educating people on what correction might be needed can be really helpful in helping correct that situation and improve the animal's welfare. So I'll talk a little bit now about some pain scales that are available. These are numerical scales that can assess the pain and suffering of an animal. They're going to be most effective when it's documented by a veterinarian. And like Taylor was talking about, when it comes to communicating with your veterinarian, this is one thing that as a veterinarian I can tell you it's easy to kind of forget to talk about in your medical record, because other veterinarians are going to be able to read your medical findings and be like, oh, that was a bad situation, that animal was in a lot of pain. But if it's something that you request, and to have a veterinarian describe how that animal was suffering, how that animal was painful, that also can be really compelling evidence. And your veterinarian partner is going to be the expert in determining when an animal is experiencing pain and suffering. So there is a dog scale, it's out of CSU, and so, operates on a 0 to 4, 0 being a super comfortable dog, normal at rest, happy, content, and 4 being, lateral, maybe unresponsive, uncontrollably groaning, crying, things like that. So, it's important, I think, not only for, moving forward with cases, but also, we're going to talk a little bit about animal handling. And if you guys are able to recognize when an animal's in pain, you're going to be able to help keep that animal safe and keep you safe too. So cats love to not tell you when they're in pain. They love to hide their pain, but they do have trouble controlling the expression on their face. So I like to look at a cat's face to determine if that animal might be uncomfortable. So a normal alert cat is going to have these eyes staring straight ahead. They're going to be wide open. Their ears are going to be forward. Their whiskers and their face is going to be pretty neutral. As they get more painful, they're going to develop this kind of like grimace. It's almost like a pain scale in humans. If you've seen like the little smiley faces in the hospital where it's, they have you rated on 1 to 10 what your pain is. A really painful cat is going to have the squinty eyes. Their ears are going to be to the side. Their mouth is going to kind of flatten out into this line, and you may notice their head kind of sinks into their shoulders a little bit too. And so again, if we see that, that's going to be a painful cat. And, obviously in our position, we're likely still going to have to handle that cat, but we might exercise a little bit of caution, maybe approach them a little bit differently than we would otherwise. So here's a cat I saw the other day. Do you think this cat is comfortable, just looking at his face right there? Yeah, I don't think so either. His name's Billy. He was surrendered to a local cat rescue with some pretty severe untreated allergies and had a lot of self-inflicted wounds on his face. So I'm gonna play this video of me introducing myself to Billy for the first time. We'll talk a little bit more about introductions later, but when I'm introducing myself to cats, cats generally prefer the first touch that you make to be on their face or their neck, but watch how Billy reacts when I try and engage like that. So he's clearly interested in engaging with me. He just vocalized, he's moving forward. And then I go to touch him and he's like, whoa, I hurt there. And so, you know, that might be interpreted as like aggression or something like that, but really it's just Billy saying he's painful and can't be touched there. When I lower my hand and try and pet him around his neck, I get a much different reaction. So just something to think about when we have these animals with injuries, making sure we're avoiding the injuries and trying to change how we interact with them so that we can keep them comfortable. So there is a pain scale for rabbits as well. Rabbits, being a prey species, very similar to cats, love to hide their pain. They don't like to tell you that they're painful. That's just an evolutionary response to prevent predation on their part. But we're gonna look at the same kind of features that we do for cats as well. So we're gonna look at their eyes, we're gonna look at their nose, we're gonna look at their ears. A comfortable rabbit is gonna have their eyes wide open, their nose is gonna be this kind of relaxed U shape, and their ears are gonna be pretty straight ahead. As we get more painful, our eyes are gonna get more squinty, our ears are gonna pin back to our head, and our nose is gonna get kind of pinched. So just again, a resource that is available, might not change what you have to do in the field, but if you're seeing some of these signs and you're taking this rabbit to a vet, also can be something that we chat with the vet about and see if they can assess and make a determination on what kind of pain and suffering that rabbit's experiencing. And so last scale that I think most people are gonna be pretty familiar with is the Purina body condition scales. Is this a resource you guys have used and are pretty familiar with? Yeah, I figured. So body condition scales on the Purina scale go from 1 to 9. Like I said, I generally prefer it from a 1 to 5. I find with 1 to 5s, I end up using a lot of half numbers, sometimes even quarter numbers, which can be confusing, especially when we're presenting these numbers to lay people, a judge, a jury, that might not really kind of understand the nuances of them. So I find the 1 to 9 scale is a little more easily understandable, and just provides a little more nuance. So I've body condition scored a lot of dogs and cats, as you can imagine, and so I can kind of look at an animal and have a number in my head after kind of putting my hands on him and figuring that out. When I'm writing a report for a potential case, I still am going to refer back to these scales because, again, I don't want to just write that the dog was a 1 out of 9. I want to write that the dog was a 1 out of 9. He was emaciated. I could visualize his ribs, his lumbar vertebrae, his pelvic bones from a distance. He had loss of muscle mass. That's going to paint a much more vivid picture for the lay people that are assisting you in these cases than just saying a dog is a 1 out of 9. And so with that, we're gonna touch base about some body condition scoring. So we'll start with dogs and cats. That video is a little distracting, isn't it? This is a obviously not skinny bulldog that I spayed a few years ago. So my first question is, when do we start to get concerned when we're in the field and we see a dog whose BCS is not normal? Or maybe I should start with what is a normal BCS? On the Purina scale. We'll talk about the Purina scale. Yeah. So I generally consider 4 to 6 pretty normal. We'll give some leniency for those people who express their love with treats. And so then, and I'm going to spend most of this lecture talking about underweight animals, but like Taylor mentioned, an overweight animal absolutely can be a neglectful and potentially dangerous situation as well. So that's something to consider. Would I recommend moving forward with charges on a dog that's 9 out of 9 with no other problems? Probably not. Would I maybe recommend moving forward on charges with a dog that's 9 out of 9 who's unable to walk, has overgrown nails, and, terrible teeth? Potentially, yeah. So it depends on the context and all that. And then on the skinny side of things, I generally start to get concerned when we have like in that 2 range, maybe a 3 range. But we're going to talk about some exceptions to that because there are some differences in life stages. There's some differences in breed conformations that make it so, I've had a dog come to me, brought to me by law enforcement that say, look how skinny this dog is. And I'm like, well, there might be a reason for that, and we'll talk about that. So let's talk a little bit about the visual limitations we have when we're body condition scoring. So these are 2 different pretty fluffy dogs. Both have been patients of mine. One is a 6 out of 9, and one is about 25% of the body weight he's supposed to be. You can probably guess from some context clues that one is like happy in a park and one has a catheter in and is in a kennel, which one's which. But, and I know this picture of, his name's Odie, does a little bit of disservice to him since you can't see his full body, but we had the hardest time getting good photos of this dog. He came in following a visit to an emergency clinic in hypovolemic shock. He was unable to stand. He was probably like 12% dehydrated, and he weighed less than 6 pounds. Following recovery, he was 23 pounds. So pretty, wow. You guys awake? So pretty drastic change there. And then this other one is a long-haired Chihuahua, and I'm still his emergency contact because he's the best boy in the whole world. And the same is true for cats as well. And I would actually argue that it's more true for cats. When we're visually assessing cats, even the short-haired cats, it can be pretty difficult to accurately assess their body condition. So this cat here is sitting on my lap. That's Dorian. In his prime, he was probably a 6 or a 7 out of 9. And here is Flossie, the world's oldest cat, who turned 27 recently. And you can tell from these pictures, it's pretty difficult to assess who's skinnier than the other one. But I can tell you that a 27-year-old cat is rocking like a 3 out of 9. So, and they're both short-haired cats. So just, all of it goes to say when we're assessing body condition and we're doing it visually, we're not able to lay hands on the animal. That's an important thing to document in our records because that can change. And it also may explain why you might see something in the field and document a dog a certain BCS. And then, when it goes to a veterinarian, they're going to document a different BCS because they were able to palpate the animal. Just something to think about. So now we'll talk a little bit about emaciation and starvation. So emaciation is a state of undue thinness. Basically, that's having a low body condition score. There can be a few different causes of that. Certainly, lack of access to nutrients or starvation is a potential cause, and that's a cause that, of course, we're going to want to move forward with cruelty charges on. But there are other causes, there are other things that are happening inside that animal that can cause that body condition score to decrease. So that pet might have cancer. Geriatric animals tend to be in a degenerative, kind of muscle wasting breakdown process that can cause them to lose body weight, or they could have some gastrointestinal disease that is causing them to not be able to absorb the nutrients that they're being provided. So just, some kind of food for thought there, because just because we have a skinny dog, I would say that doesn't automatically make it a cruelty charge. Now, how do we tell the difference in these cases? So absolutely we can chat with the owner. Really the best answer is you feed them and give them time and see if they gain weight. But of course, we don't always have the luxury of time. So, some things I'll look at are what's their attitude like? What's their energy level? Are we seeing any gastrointestinal signs? Are they vomiting? Are they having diarrhea? Are they giving us any clues kind of right away that they might be experiencing some illness that's causing them to not, gain weight appropriately? And then the next question is like, does it really matter? And I think the answer to that question is it depends. If you chat with the owner and they're like, oh yeah, he's been losing weight. Well, if you have a dog that's a 1 out of 9 and they've been losing weight that long, then maybe it doesn't, because that's still lack of, adequate veterinary care, and that's, that's a negligent decision that they made. But if they're like, oh my gosh, here are all my vet records, here's the vet I've been going to, we did blood work, they were hospitalized, they did all this, that might change my interpretation of that situation and might change, what I want to do going forward. So just a few cases, they both have happy endings. So this is Munchie. Munchie came in as a stray. He obviously was pretty thin. Someone said they found him next to a dumpster, or next to like the garbage area in their apartment complex. As you can see, Munchie looks pretty young. His eyes are nice and clear. He's pretty well muscled. I know picture, and again, we're doing visual BCS scoring on these, but any thoughts on what you would score him based on the top-down view? I agree. I would give him around a 2, maybe a bit of a generous 2. His ribs are visible from a distance. Pelvic bones are visible from a distance. I can see his spine pretty well as well, but he is well muscled. He hasn't started to lose that muscle mass that you generally see at the 1. So Munchie came in. We fed him a meal. He immediately vomited it up. He started regurgitating even water. So based on that, do you guys think this is a starvation case? Yeah, I didn't think so either. We did some x-rays and took him to surgery. He ended up having a foreign body obstruction. Munchie had made some poor life choices and eaten things he shouldn't have. Ended up needing about, probably like 2 feet of intestines resected. And after like a week of hospitalization, he did great and got adopted to a lovely home. If we found an owner, which ownership was interesting in this case, the finder was registered to Munchie's microchip. But he refused to admit that he was the owner. Would you move forward with charges if you guys had an owner in this case? This is kind of a tough one, right? Because foreign bodies are tough. They're expensive. It's a really expensive surgery. And the fact that, Munchie had been profusely vomiting and to the point that he had lost this much weight, there I think was some neglectful situation going on there. Would I move forward with charges? I think it would really depend on my interactions with the owner, if they had any vet records. The finder/owner had taken him to the vet the day before. He allegedly found him by the dumpsters, took him to the vet, and then brought him to the shelter. So interesting history for this guy, but he was lovely. All right, and then this is Miss Ella. She, strangely enough, was also found in a dumpster in Lakewood. She's a juvenile dog. She had all of her deciduous teeth. I aged her around 8 to 10 weeks of age. So when I look at her in this photo again, it's not the best photo for body condition scoring, but I can count all of her ribs. When I look behind her eyes, I see a little bit of a hollow cavity right here, which tells me that she's got some muscle wasting. Any thoughts on what her BCS might be? I'd give her a 1 out of 9 for sure. She's a slam dunk for it. So we hospitalized her, offered her food. She ate ravenously. No GI signs. Was this starvation? I agree. Again, this is another one where we didn't have an owner. She was found by someone in a dumpster in Lakewood. But if we did have an owner come forward, I would have recommended moving forward with charges. I think it's very likely this was a starvation case. So, briefly, we'll talk a little bit about some differences in life stages. So, dogs and cats go through a growth phase in their puppyhood. Especially large and giant breed dogs, it can become really difficult to keep weight on them at that age. And so, for people who automatically think that they can see ribs on a dog and that they're too skinny and they have to gain weight, this can be kind of an exception to that rule. So here's a Great Dane puppy that I can see ribs on him, but I'm not worried about his weight. I know he's young. I can tell by his goofy legs and his stupid face that he's a baby. And so, and I know that it's firstly very difficult to keep weight on these dogs as they're growing so rapidly, and secondly, dangerous for them to grow too fast. So that's a situation where I'm not going to be super worried about a dog that might be a little underweight that I potentially would score as a 3 out of 9. And then when dogs enter their adult phase, and I'm saying dogs, this applies for cats as well. When dogs enter their adult phase, the biggest difference there is if they've been spayed or neutered. Once you spay and neuter a dog, their metabolic rate goes way, way down. Whereas intact animals that have the benefit of that testosterone, that estrogen, they just tend to burn calories faster, and sometimes, especially those like really beefy intact male pit bulls, it can be kind of difficult to keep weight on them. So when I have a dog present to me that's an intact male and is a 3 out of 9 versus a neutered male that's a 3 out of 9, I'm going to respond a little differently to those situations and think about the context of how their physiology is affecting their weight. And then we have our old timers, our geriatric dogs, our senior animals. And those guys, again, like I said, enter a degenerative process where they're not actively putting on weight, they're kind of breaking down. And so in those situations, it's not uncommon for those dogs to be a 3 out of 9. And so those are also situations where I might see ribs, but depending on, chatting with the owner, those kind of things, other, comorbidities, I might not be as concerned about them. So things that we can look for in the field to assess if a dog is older, the first thing I look at is their eyes. I mentioned that face shot with Munchie earlier. His pupils were nice and dark. He didn't have any of that like cloudiness or graying of those pupils, so that's something to look for. Older animals also tend to develop lots of kind of warty papilloma lesions. That's something we can look at. And they tend to lose muscle mass, especially in their hind end, and that's especially true of cats. So those are all things that we can look at to kind of just ballpark, be like, okay, that's probably an older animal. That's, not an older animal. Why can I see your ribs? So here's my dog, Bailey Bad Dog. She is about in her prime, probably about 55, 60 pounds, made it to 16 last year, so she defied all odds. It's always the bad ones that live forever. So as you can see in this picture of her face, not all of that is camera reflection. That's just how her eyes looked. So she had those really gray, that really gray age-related change. And then here's her at her Sweet 16 party that we threw her last year. You can see this line on her back legs. That's all muscle wasting. So her legs were little chicken legs towards the end. And she's a pretty fluffy dog, so I can't see the outline of her ribs, but I can see, this ridge here. I can see a little bit of pelvis here, and her spine's pretty prominent. So in this photo, she's probably a 3 out of 9. And I thought a lot about that when she was still with us, because I'd be like, gosh, if she was a stray, I'd totally get a summons from animal control. But, she was on pain meds, and she was a pretty happy dog. So just things to think about when we have these older guys. And then the last thing we'll touch on is breed differences. So here we have a Dachshund and a Chocolate Lab. I would give them the same body condition score. Do you guys have any thoughts on what you would score them at? I'd say between like a 5 and a 6, probably. Difficult to say without putting hands on him. If that Chocolate Lab came into me, I'd say he looks great, everything's perfect, don't change a thing. If that Dachshund came into me, I'd be like, maybe let's lose a little bit of weight. Let's drop a few pounds. Because those long back dogs are so prone to back injuries, and obesity and being overweight is one of the #1 risk factors for that. So breeds that I think about that I would rather see on the skinny side than the, kind of slightly over-conditioned side are going to be my long back dogs, my Dachshunds, my Corgis. They're going to be my smush face dogs too. So my pugs, my bulldogs, my Frenchies, all those kind of things. Because those guys just are already at a disadvantage when it comes to life. So if we can keep them skinnier, we're going to keep them healthier. So I don't get too fussy if a Dachshund comes into me and I can see his ribs. I'm just like, well, is he eating? He's peeing, pooping? Cool. So All right, and so now I'm just really briefly gonna kind of touch base on some of our exotic species. And the biggest takeaway for these guys is like you have to put hands on them if you want to body condition score them. So here are two rabbits. I think Taylor used a similar picture from the Montezuma case, and these rabbits are underweight, but it's almost impossible to tell that in a photo. And even this body condition scoring chart, the difference, I mean, maybe you guys feel differently. To me, the difference between an emaciated rabbit and an obese rabbit is pretty difficult for me to assess. And so you really have to put hands on these small mammals in order to appropriately assess them. So, I look way more at, other things. Obviously, this was, on the TACC scale, I would score this a 5 on the environmental enclosure, no access to food or water, several days to weeks accumulation of feces, those kind of things. And the last thing I'll say is when it comes to small mammals, and this is also true for birds, if we do have a situation where we have some starvation, we have some animals that are emaciated or underweight, it's not uncommon to see some significant mortality in those populations. These guys just are pretty fragile, and it can be difficult to nurse them back to health. So birds are the same way. Visual body condition scoring is difficult. Sometimes our parrots do us a favor and feather pluck all of their feathers away, and then you can see their breastbone a little bit easier, but not always. So with birds, really what we're looking at is that it's called the keel, that breastbone, kind of right in front of them. You want it to be a nice U shape when you palpate it. You want to be able to feel the protuberance of the bone, but also have really, well-muscled chest on either side. If you palpate it and it starts, your hand kind of sinks down and you're getting some concavities there, that's a bird that's pretty skinny. And then reptiles are difficult too, because you would kind of expect like, oh, on a snake you should be able to see ribs, right? That tends not to happen just based on their scales and the way they lay down muscle. And so what I look for on those guys are where they generally are putting their fat down. And so in lizards, especially like bearded dragons and leopard geckos, two of the more commonly pet lizards that we encounter, they really like to put fat down at their tail base. So I like to look at their tail base, and they also will have a fat reserve behind their eye. So I look, those are kind of the two spots I look. Occasionally in these guys, especially the younger ones, you'll be able to see pelvic bones too. So those are things we can look at. And then snakes, we actually, kind of can use the body condition score for birds too. They should have, their spine, and it should be really well-rounded on both sides. If you start to see that concavity from their top line down to their belly, that's going to be when we have an underweight snake. Reptiles we often tend to find these guys are pretty dehydrated. Once they get emaciated, they kind of shut down and stop engaging in, normal activities like soaking, things like that. And, the nice thing about reptiles is they do everything slowly. They get sick slowly, but they also get better slowly. So you generally have a little bit of time if you can find someone that knows what they're doing and is able to nurse them back to health, but it can be a really prolonged process. So here's a ball python. We have a few other ball pythons we're going to pull out during the demonstration hour. So we can kind of compare and contrast their body condition with this one. But as you can see, this top line is pretty much a ridge right here. And especially right here in the photo, you can see that shadowing right there. That's a pretty emaciated snake. So that's definitely a snake I'm pretty worried about. Any questions on body condition scoring before we move on? Cool. All right, so next topic is going to be handling and behavior, and this I could do several hours just on this, so we're just going to kind of breeze through some things, and this is your idea. We're going to breeze through some things, and we'll try and get some hands-on demonstration. I'll try and kind of show you guys a few different techniques that I use based on, how nervous, how fearful an animal might be. And I'm going to focus more on some of the subtle changes that we can see and moments that we may have to, kind of repair interactions with an animal before they end up at that, really really scared dog, that really scared cat. I think you guys all know what those animals look like, so I'm not going to focus too much on those. But when it comes to handling, human safety is always the #1 priority. We want to keep, we want to keep you safe, we want to keep your teammates safe, and we don't want to hold a dog on a BQ if we don't have to. So that's just always the #1 priority when we're handling these guys. We're going to stay calm, and we're going to over-communicate with our team members before we do anything. If we're holding a dog and we're losing grip, we're going to say that before we let go. If we've got a cat in a scruff and we're trying to get in a kennel, if we start to feel that cat tense up, we're going to communicate that as soon as we can. When we have an aggressive animal, I think it's important to remember that aggression is not always, but almost always the result of fear. And so, I know, especially in these big hoarding cases that we're dealing with, we have all these animals, we've got all these cats we have to get out, and it can seem really overwhelming to try and kind of calmly handle all of those animals. I think it can be really valuable to take the extra few minutes, extra few seconds sometimes to move slowly, move at that animal's pace, and try and have a positive introduction. That I think can go a long way in keeping handling safe and keeping the experience from being too traumatizing. So some tools I think we should always have when we're handling. Towels, I think, are a really underutilized resource, especially when it comes to cats. I'll show you some techniques on my own personal cat. I'm sure he's going to love it. And then for dogs, we're going to want to have our slip leads. We're going to want to have our catch poles. We're always going to try and use a slip lead first, so long as we can safely do that. And then also for cats, cat gloves can be really helpful, especially when we're handling those guys who have completely crossed their threshold of, trying to have a pleasant introduction. And then a cat net. Is that something that you guys use in the field a lot? Yeah. So those can be really helpful. They keep handlers safe, and I think generally can keep the cat safe too. If you can safely net them, you can prevent them from making foolish choices. So let's talk a little bit about behavior in dogs and what we look for. Is that dog comfortable with what's happening right now? No, I don't think so. So there's a scale for cats as well that we'll talk about, but fear-free pets, it's generally a veterinary resource, but I think it can be really helpful, just kind of in general, in recognizing the signs of fear and anxiety. And again, I think we all know what a score 5 looks like, so I'm not really going to talk about that today. I'm going to talk more about these in-between phases where we may have an opportunity to change how we're interacting with that animal and improve the safety and, just kind of improve the experience for everyone. So we're going to be looking at their eyes and their ears. So this fun little picture is a great example of some pretty freaked out eyes. So the whale eye is kind of that classic thing we look for. When we can start to see the whites of a dog's eyes, that's my cue to, maybe take a step back, change my approach, and see if I can improve things. Their ears, a relaxed dog is going to be engaging with you. Their ears are going to be forward, maybe swiveling around if there's noises going on in the background or the side. A nervous dog is either going to have their ears pinned, or if we get to a point where they've passed their threshold, their ears are going to be forward, and it's going to be that, kind of forward aggression. And then their face, it's tough to describe, but I think we all know what a nervous dog looks like. I usually describe it as like a furrowed brow. And I mean, this picture I think is a really good example. That mouth is pretty tight, especially in the beginning. You even get a little bit of a lip curl right there. And those eyebrows are, kind of tight and tucked together. And then we look at their tail too. So true or false, a wagging tail means a friendly dog. Great. So what a wagging tail means is that dog is willing to interact with you. That does not mean it is in a positive or a negative way. So we have to look at the other signs that they're giving us to determine if that wagging tail means they want to be friends or not. And then when we're transporting dogs, it might be easy to assume that the dogs came from the same house and so they want to be in the same kennel. That may or may not be true. So it's, just something to think about when we're transporting them. We're putting them in a really stressful situation. So sometimes the safest thing to do, with the exception of like a mom and a litter of puppies, might be to separate them. And then wherever they're going, a shelter you're taking them to, wherever they're going, then they have some time to decompress and they can make the decision on if they should be housed together or not. So here's a quick video on some other subtle signs of stress in dogs. So lip licking, that's something we see in cats a lot too. Panting. And then panting, that also can be a sign of pain. So don't let that one fool you if you're seeing it.
Brow furrowed, ears to side.
We talked a little bit about that one already.
Moving in slow motion. Yawning that seems out of place.
This one makes me so sad, the nervous yawn.
Hypervigilant. Moving away. Pacing.
And we often see this in conjunction with hypervigilance, as you can see with this dog.
If initial warning signs are ignored, the fear can lead to anxiety, extreme submission, barking, growling, air snapping, biting.
So you see how she's kind of hovering over that dog? That's not the way I would have approached that dog.
Here's what you can do. Be an advocate for dogs in need
So
of
obviously
space.
not all of this applies to us. It'd be great if we find these dogs in the field and we could just ignore them like they recommend. Obviously we can't ignore them, but what we can do is try and take a few extra minutes to try and make them feel a little more comfortable. And so in a minute, they're going to have a good example of what can be a productive way to try and introduce yourself to a dog like this.
Tossing treats can help counter-condition a dog to people that they might otherwise be fearful of.
And so you see how she's sitting on the ground, she's turned sideways, she's not making eye contact with that dog, and she's just tossing some treats to him. That can be a good way, and I'm not going to pretend and say this is going to work with every dog, but there are some nervous and fearful dogs that this is going to help, kind of build that relationship. So, and another thing I forgot to mention in our tools is treats are such an important resource that we can have for these guys. And milk bones are great, but I like to carry like some cheese with me or like a little bit of hot dog, something really high value that hopefully can make friends much more quickly than like dry dog food. So a few pictures. Which dog would you feel more comfortable approaching? Yeah, that was a pretty easy one, right? So number one, I don't recall this dog being aggressive. I think he was just like kind of psychotic. But but if I see that dog in the field, I'm going to be a little hesitant. I'm going to move a little bit more slowly and try and take my time and see if we can find a place where we both feel a little bit safer. And so here's two other dogs. Which one would you feel more comfortable approaching? I agree, yeah. I think one is a lot more comfortable. His eyes are nice and soft, his ears are forward, his face seems really relaxed. Now two, it's pretty subtle signs. She's sitting, she doesn't seem super tense, but she's definitely has a little bit of hypervigilance going on. Her ears are, you know, a little bit to the side. Her eyes are kind of darting, you know, back and forth. And so that's going to be a dog that I'm going to be a little more cautious of. So we talked about this a little bit already. So when we make our introductions with these guys, we're going to try and not hover over them. We're going to try and kind of get down on their level and kind of stay to the side. Dogs tend to prefer to be touched first on their side or their neck as opposed to their head. So we're not going to hold our hands over and kind of hover over them. And whenever a dog will walk of their own volition, that's generally preferred. So we're going to try and get a slip lead on them. And we'll go over some techniques that we can use slip leads for. You know, when we have some injuries, we might need to make a harness out of it so that we're not, you know, causing more injury to a neck. Or if we have those smush face dogs, we're going to want to do that. And we're going to use our catch poles when we need to keep them safe. But I've seen a ton of injuries with catch poles. Dogs like to alligator roll with them. They bite their lips, they bite their tongue, and it can cause a lot of trauma. So if we're able to get a slip lead on a dog, that generally is preferable. And when we're lifting and carrying dogs, we're going to control their head, especially with small dogs that might be, you know, a little bit like that terrier from the video. We're going to use some towels to pick them up. We can go over some things like that. And we'll do a quick demonstration of a leash muzzle as well. So this guy is going to create a harness out of his slip lead. He's going to loosen the slip lead off the neck. He's going to loop it around behind the forelimbs. Pull it through the other side. And then now when that dog pulls, when that dog doesn't want to walk and we have to put pressure on, we're not putting pressure on his trachea, we're putting pressure you know, on that chest and behind those front legs. So that's a quick and easy way to you know, keep a dog safe. One instance I really think about this, I had a dog come in to the shelter one time who had a bark, like a shock collar, embedded in his neck, and he was a super sweet little puppy, and then the officer went to go put a leash around him, and he started screaming bloody murder, lost his mind, and it's because the leash was putting pressure on that injury. And so then a leash muzzle is something I like to use so if you think of that like tan pit bull from one of the previous slides, if I had to slip lead her and pick her up, I would probably use my slip lead to wrap around her muzzle a few times to pick her up and lift her into a kennel, just because I don't super trust her and I want to make sure I'm keeping everyone safe. So we'll talk a little bit about cats. Same kind of thing with cats. We're going to look at the same features, those eyes, ears, their face, their body, and their tail. We're going to look at a few different things. So cats, you know, aren't going to whale eye at you like dogs will. The biggest thing at their eyes that I look for is their pupil size. Their pupil size is going to tell you a lot about how comfortable they are. And cats love to do this super cute thing called a slow blink when they're really relaxed and they're pretty happy. It's their way of expressing affection. So I'll sometimes use a slow blink when I'm introducing myself to a cat to kind of gauge where their comfort level is. When we're looking at their tails, a relaxed cat is going to either have a tail that's kind of like just kind of slowly moving as they're laying down, or when they're walking, it's going to be straight up and in that kind of candy cane posture. When we see the tail start to get really poofy or it's flicking really rapidly, that's a cat that we're starting to lose some time on, and we need to either change what we're doing or do what we're doing a lot faster. When it comes to kenneling cats, I would encourage you to kennel cats individually from the same house. Again, you know, transporting is a really stressful situation, and I've definitely seen cats that owners say are the best of friends at home, and then I, you know, pull them out at a vet office, give them vaccines, put them back in, and then there's a cat fight in a carrier, which is not a fun situation. But again, litters of kittens less than 6 months of age generally are safe. Kittens with moms, for the most part, are safe. I did have one situation where a mom attacked a 3-week-old kitten from a hoarding situation, but that we'll call that an outlier. All right, so we've got 1, 2, and 3 up here. Who do you think is the most relaxed cat? Yeah, I totally agree. That's my cat Squash. So he's definitely relaxed. His eyes are nice and soft. His ears are forward. He's stretched out. He's pretty happy. One is not super happy, and I wonder if actually 1 and 3 might be showing me a little bit of signs of pain as well. So one, you can see his eyes are starting to get a little squinty, and his head is kind of sinking into his shoulders a little bit, and those ears are to the side. Number 3, of course, is a little kitten that I'm snuggling against his will. But if that was an adult cat, I would be exercising much more caution. So again, when we're introducing ourselves to cats, one thing I like to do is do a little slow blink to them. That can kind of gauge, if they slow blink back to me, I'm gonna feel more comfortable in moving forward quickly. Unlike dogs, cats tend to prefer to be touched on their face or their neck first. And another thing, I will kind of offer my hand to see if they target my finger. So if they kind of lean their nose out and touch my finger, I'm gonna feel more confident moving forward with them. Before I press play on this video, is that a comfortable cat? No, I think he's a little, I describe him as conflicted. You'll see why when I press play. So this is me introducing myself to this cat. He is making biscuits. I slow blink at him a little bit, and you can tell he slow blinks back. He doesn't want to target my finger, but when I go to pet him, he starts to relax, and he leans in. And he's a real nice boy. And so that took me, I think the video is 22 seconds long. And you can imagine, just looking at that cat there, if I had just reached in and tried to scruff that cat, I think I would have had a much different reaction. And so taking those extra 20 seconds to build that relationship, I think can go a really long way in making things just more successful in general. We're always gonna use carriers when we transport cats. We're not gonna try and carry cats outside into a truck. Towels really can be your best friend. We'll talk a little bit about some scruffing techniques too. Scruffing is a little controversial. You might find some veterinarians who tell you it's terrible. I think it can be a way to safely transport a cat short distances. But you should be warned, some cats will react very negatively to a scruff. So just proceed with caution. So here is a toweling technique for cats, which can be successful if you're brave enough to try it. So you can see that cat kind of slipped out the back end of the towel, and then when Dr. Yin grabs him, she kind of grabs the whole cat in a little burrito. So that's kind of the key when we're trying to towel cats like that, is we want to make sure we're controlling the whole body, because they like defy physics and they turn into a non-Newtonian solid when you're trying to handle them sometimes. All right, so now I know we're running out of time. Just really briefly, let's talk about handling some small mammals. When we're dealing with behavior with these guys, we're going to see prey species behavior. Their first instinct is going to be to retreat, but I will say I've been bitten by more guinea pigs and rabbits than dogs and cats for sure. So don't underestimate their ability to turn on you if they decide retreat is no longer an option. Rabbits will thump before they start to turn on you generally, to tell you that they're getting pretty pissed off. So you'll hear that kind of back leg kicking. That's your cue that they're getting ready to launch at your face. And when you're picking them up, rabbits can break their back with the force of their back leg kicks. So when we're handling rabbits, when we're picking them up, of course, we're never going to pick them up by the ears. We're going to control their whole body and make sure to control and support their back end and hold them really close to our body. Mice and rats, you can scruff. I'll scruff them the same way I do a cat. It ends up being kind of less of a scruff and more of just kind of holding the skin on their whole back. We're not going to pick them up by their tail, but I will sometimes use their tail to control them while I'm grabbing their body. And here's a good example of someone holding a rat in a good way too. We can also kind of use our fingers and kind of lock their head in. Hamsters are too small really for any specific body handling. I would recommend using a glove if we're grabbing a hamster. And then guinea pigs, they will squeal firstly. They're gonna scream and sound like you're killing them. So usually what I'll try and do is pin them down so they can't move away from me, and then kind of rotate my hands, position my hands so that I'm able to kind of get behind their front legs and pick them up and move them in a carrier. And if we have an enclosure that we can transport these animals inside their enclosure, that might be preferable. It's going to keep you guys safer, and it's going to be less stressful for them. So real quick, picking up a rabbit.
You can see here that I'm using one hand to cradle her chest. I'm right-handed and almost always use my right hand for this. Then as I lift, I'm supporting her back legs with my left hand and bringing her in close to my body. By kneeling, you can see how I was very quickly able to provide the support of my body. Notice that as I hold her, I'm keeping her parallel with the ground to make her feel as stable as possible.
And this is
to avoid.
This is her pet rabbit, so she's scratching the rabbit. What I would do here is kind of use my hand to position kind of over their neck and like secure their front limbs so they don't try and take a flying leap back down to the ground.
You can see here that I'm using.
All right, so birds and reptiles. When it comes to birds, the main thing we're gonna see is they're gonna start vocalizing and they're gonna get agitated as they start to get upset with what we're doing, which with birds is generally just existing. We upset them. So you can, with parrots and parakeets, some of them are trained with an up command. So you can, if you're feeling brave, put your hand in the enclosure and say up and see if they will step onto your hand or your arm. They can still bite you when they do that, and often they choose to. I would encourage you to try and move them in their enclosure when possible. They can be very fragile, and they're prone to breaking bones with handling. Covering the enclosure with a towel definitely can help prevent some stress. If you are having to remove them from their enclosure, biggest priority for animal safety is controlling their wings so that they don't flap and inadvertently cause a fracture. Biggest safety feature for you guys is controlling their head so that they cannot gouge you with their often overgrown beak. And then again, we talked a little bit about this with skinny birds and skinny small mammals, but it's especially true with sick birds, is we need to use extra caution when we're handling them because oftentimes any little bit of stress may cause a rapid worsening of their condition. Reptiles, we're not gonna do what Steve Irwin's doing here. We're not gonna pick them up by their tail. We're gonna support their whole body. We're gonna try and control their head. Most lizards are generally gonna try and run and hide, and you can kind of corner them. There are some species of snakes that may be more likely to strike at you, and if you ever have to deal with an iguana, always control the tail before you control anything else. Again, towels covering them is gonna make things a lot less stressful when we're transporting them. And just one fun fact about some lizards is they have autotomy. They can self-amputate their tail in a self-defense mechanism. It's not dangerous, but might not make your owner super happy if they get their lizard back and they're missing part of their tail. So that's a real quick overview. I know we ran a little bit over. I'm sorry, guys. We do have a hands-on demonstration, but I don't want anyone to, feel forced to stay late. So anyone who chooses to head out now, no hard feelings. Otherwise, we'll demonstrate some hands-on stuff with dogs, a cat, and some snakes. Yeah, we could do that.